Before we get started on this course, I want to talk a little bit about safety and pain. So as we go through this, there's a really good chance that you're going to feel a little bit of discomfort. That's normal. No matter how hard anyone is exercising, almost always, they're going to feel their joints moving. They're going to feel muscles and tendons and ligaments doing things that are kind of uncomfortable. For most people, that's entirely normal, and it should fade within an hour or two after we're done an exercise. But there are going to be instances that, because we can't know everything about you, where that's not going to be the case. So I just want to make sure that you understand those and what to do in those scenarios. So first and foremost, I don't want you to feel any new pains that you didn't have before that last after we're done exercising. And by that, I just mean I'm expecting, because we're doing knee exercises or hip exercises or foot exercises, for those to get a little bit uncomfortable. But what you shouldn't feel is a pain that's very sharp or really uncomfortable and lasts for a long time afterwards. So if you have a new pain while we're doing things, please get it looked at. Another thing that we shouldn't get is a significant intensifying of pain. For most people, if they've had a knee replacement or a hip replacement, as you've probably experienced, you get a huge relief. Most people find they feel significantly better after they get these things replaced. However, if you are finding that you have pain and it gets worse with exercise and then stays worse once you stop exercising, again, that's a reason to go and seek medical care. Another thing that can happen when you're doing an activity you haven't done before is what we call referred pain, which means you have pain in one area, but it's not because we have a problem in that area, it's actually coming from somewhere else. So usually some big signs is that the pain is really vague, meaning it's in a broad area, or it's numb, or it's tingling, or it feels like it's shooting. Those are the kind of pains that we don't want to mess with. We again want to seek medical care. There's a difference between discomfort and things intensifying because of exercise, and pain that's just there because we're doing something our body doesn't like. And there's a little bit of a game to be played to make sure you know the differences in your own body, but if in doubt, please seek medical care with any of these kinds of pain. One thing that we want to be on the lookout for during this course is balance issues. Most of the time, we're going to be in a chair. That's entirely fine. We're not going to run into big issues. But we are going to progress to a little bit more standing as the week goes on. So if that's you feel like you have balance problems, either from a lack of sensation in your feet or from an inner ear issue or from some other issue, please make sure that the area around you is ready just in case something happens. Make sure you have things to hold on to, make sure you have things to support yourself with, and make sure that if you do have any kind of slip and fall, the area is good for you to get up and make sure you don't hit anything. Balance issues are something we have to be very, very careful with, especially because once we've had a joint replaced, either a hip or a knee or otherwise, we lose sensation in that joint. We lose the feedback it gives our brain, so balance can become a little more precarious. Please be careful if you have balance issues. One other thing to be aware of is that you could have had other surgeries in other places. If you're like me, you've had half of your major joints worked on at some point from some injury or something. So if you've had a knee replacement, but you've had a hip surgery, or you've had a hip replacement, but you've had a foot surgery or a foot problem, just know that those are going to affect what we're doing. A lot of the time when we're exercising for a knee or for a hip, we're also going to exercise things nearby because it all works together. But just know that if I tell you to do something for your hip, but it's bothering your knee, that's also the same rules apply. We want to make sure that we're not bothering other joints. We don't want to sacrifice one to help another. So please be cognizant of this. Just because I want you to do something to help your hip doesn't mean that it's worth you sacrificing a back or a knee or feeling bad in any other way. Last thing is that if in doubt, you need to be medically cleared to do any of these exercises. Almost all of them we are going to have very, very little risk for. Most of them are very gentle. They're going to strain our muscles, but they're going to do very little to joints. But every single joint that gets replaced is going to be slightly different. The hardware will be different inside. The way that your hip worked before is going to be different as far as its function goes. So if in doubt, please get medical clearance. The vast majority of the time, things are going to be fine, but some people have a little bit precarious differences depending on what happened during their surgery and depending on how far post-surgery they are. If in doubt, make sure that you have the clearance of a registered healthcare provider before you do anything you're uncomfortable with.